Can perimenopause cause yeast infections? If you're in your 40s and suddenly battling infections you haven't had since your 20s, I need to tell you something very important. I'm going to explain exactly what triggers perimenopause yeast infections, how to recognize them, and what makes them different from other infections, and most importantly, what you can do about it. By the end of this video, you'll understand your body better and have a clear path forward. Let me start by saying this isn't your imagination, and it's definitely not your fault. As a pelvic health advocate, I see this pattern constantly. Women hitting perimenopause and suddenly dealing with recurring yeast infections that seem to come out of nowhere. So what's really happening? During perimenopause, your ovaries are basically having an identity crisis. They're producing wildly fluctuating amounts of estrogen, unlike menopause, where estrogen stays consistently low. Perimenopause is being on a hormonal roller coaster. High one month, crashing the next. The vagina is packed with estrogen receptors, so it feels like every single one of those fluctuations. When estrogen is abundant, your vaginal tissues are thick, moist, and acidic, creating an environment that's hostile to yeast and harmful bacteria. But when estrogen drops, everything changes. Here's the science made simple. Estrogen feeds the good bacteria in your vagina called lactobacilli. These little guardians produce lactic acid, keeping your pH around 3.5 to 4.5, nice and acidic. Yeast hates acid, but when estrogen drops during perimenopause, these good bacteria starts dying off. Your pH rises, becoming more alkaline, and suddenly yeast is throwing a party. There's more though. Low estrogen also causes vaginal tissues to thin and dry out, which we call vaginal atrophy. These thinner tissues are more prone to tiny tears, especially during sex, creating entry points for infections. Plus, your natural moisture production decreases, so your vagina becomes less self-cleaning. Now, how do you know if it's actually a yeast infection? The classic signs are intense itching, thick white discharge that looks like cottage cheese, burning during urination, and redness around the vulva. But here's what's tricky about perimenopause. These infections often present differently. You might have less discharge due to overall dryness, more external itching and burning, and they take longer to clear up. What used to disappear with one over-the-counter treatment now might need prescription medications or multiple rounds of treatment. And here's something really important. During perimenopause, you're also more likely to get bacterial vaginosis and urinary tract infections. Sometimes you can have multiple issues at once, which makes everything more confusing. Bacterial vaginosis has a fishy odor and a thin grayish discharge. UTIs cause painful urination, frequent urging to pee, and cloudy urine. Getting the right diagnosis is crucial because treating the wrong condition can make things worse. So what do you actually think about this? The most effective approach is addressing the root cause, those hormonal changes. Vaginal estrogen therapy is often a game changer. It comes as creams, tablets, or rings, and that can work directly on the vaginal tissues to restore thickness, maintain pH balance, and support good bacteria growth. The beauty is it works locally with minimal absorption into your bloodstream. For lifestyle support, focus on breathable cotton underwear, avoid tight synthetic clothing, and skip the fancy soaps and douches. They disrupt your natural balance. Some women find probiotics helpful, especially those with lactobacillus strains designed for vaginal health. Stress management is huge too. Chronic stress elevates cortisol, which can suppress your immune system and make hormone imbalances worse. Regular moderate exercise, good sleep, and stress reduction techniques all support your body's natural defenses. Here's when you absolutely need professional help. If you're not sure if it's a yeast infection, if it's over-the-counter treatments aren't working, if you're having more than 4 infections per year, or sex has become more painful, don't tough it out. These are signs you need a different approach. One more thing, painful sex during menopause often involves multiple factors. You might have vaginal dryness from low estrogen, mild infection causing inflammation, or tissue thinning all happening together. This creates a cycle where fear of pain causes muscle tensions, making things even more uncomfortable. For women dealing with this cycle, tools like vaginal dilators from companies like Vuvatech can help gradually restore comfort and confidence when used properly under medical guidance. So to recap, perimenopause absolutely can cause yeast infections through hormonal changes that disrupt your vaginal environment. The good news, this is temporary, treatable, and you have options. Vaginal estrogen, lifestyle medications, and a professional support can make a huge difference. Do not suffer in silence. Talk to your healthcare provider about hormone therapy options. Consider your lifestyle factors, and remember that prioritizing your intimate health is part of taking care of yourself. You deserve to feel comfortable in your body at every stage of life, and there are people and solutions ready to help you get there.